just like did great, like to meditate. Oh, Hillary, so nice to see you. You have been on vacation and I've been missing you.
I've been on vacation and now I'm back. Hi, everybody. Thanks for doing it without me. I wanted to log in and be with you on my vacation, but I was on a fishing boat and it was very like, and that's a whole other story about why I go on vacation on fishing boats. We'll get into that later. But
that is not an expected thing. I would not have come up with. Hillary's fishing this week. But you know, the gone fishing sign would be a good gift for you.
I know. Kara wrote me a text like, okay, we'll get back when you're done fishing. And I'm still like extraordinarily rocky, it's the weirdest feeling when you get on land. And I'm like, but I'm telling you, we're talking about sleep and insomnia a little bit today and talking about anxiety. And I'm going to tell you, one of the medicines that I just can't even believe it is meclizine. Meclizine is the medicine that you use to prevent seasickness. And it's Bonine or something. It's over the counter. I swear it is like I was roofied. Roofied, if nobody knows, roofied is the hideous thing that's happening to women with Rohypnol, which is the date rape drug. But that's what it felt like. I would take the meclizine and in like an hour, it comes over you. Like, it's like, boom. And the only option for me was sleep. Like I literally couldn't function. I couldn't have a conversation. So I slept more on the fishing boat than I fished. And I was like,
why? That's good. You got rest.
I did. But I was like, this is such an interesting thing. Like I have all these patients struggling with insomnia. Maybe they just need to like take a little meclizine and wake up.
I think there's a nervous system issue with taking that.
No, yeah, you don't take it long term, obviously, but it is one of the things that I've never felt like so like instantly like this powerful sleep. But we're not talking, we're derailing our conversation. We're here to talk about food, mood, the connection of your gut health to your anxiety, depression, insomnia, or any kind of, not necessarily if you have true anxiety or true depression or insomnia, but if you have sort of just these waves of any of it where you feel anxious, nervous, stressed, a little disconnected, not energetic, what we call dysthymic, where it's like you just go through life and you're a little bit like, or you have a hard time falling asleep or staying asleep. So, you know, what we're really interested in is not just working in like these really, once you've been diagnosed with something, like you have anxiety disorder. Yeah, that's a thing. But I'm more interested in all the people who struggle with feeling anxious or nervous or the state before you get diagnosed, right? Like, so all the subtleties of it and trying to help correct that before so that you don't get eventually diagnosed with something.
Yeah. And okay, go ahead.
No, go ahead.
I was just thinking, you know, as you were talking, one of the things we see over and over again, and you're going to say, oh yeah, I know what you're saying, is that often you get sick, like you have a flu or a cold or you have a digestive bug, you know, people call it like gastro or a bug. And it takes people are like, oh, I'm like dragging. I think that's what it is. Like, I think when we're sick and we're fighting things, our GI tracts get a little bit of like a leaky gut kind of thing. And then you do feel more like that fatigue is that dysthymia that you're talking about. Like, you're just like the colors of life are just not as bright, right? It's just kind of like you're pushing through. And we think, oh, it's because I got wiped out by that virus or whatever I have, but it's really just the inflammation going on, I think.
So our body is like this container. I've been using the analogy lately. I don't know if it makes sense because it does sound a little sometimes pornographic. But anyway, that you're a bucket and there can be holes in your bucket. And then I talk about filling the holes, and that's where maybe it goes a little sideways. I'm like, I'm just going to fill your holes. And then I'm like, wait, that sounds really screwed up. So I might need to change the analogy. I'm like, wait,
in the gap junctions.
Okay, I was like, does that sound bad when I say to a girl, like, I'm going to fill your holes? Anyway, sorry, excuse me. But what we're saying is, oh my God. But sometimes you say these things to patients.
I know. And then you're like, that didn't come out right.
That did not come out right. But
It's like when I told the hairdresser once that they did a great blowjob.
It's so fun being
That
human
was rough.
and the
I
way
was
that
like,
we use language. And
I'm sorry.
and it happens all the time on this show,
Yeah.
which makes me just laugh. So anyway, I, the feeling of we get leaks in our system, you know, and it's a series of multiple hits. It's
Yeah.
you know, so I'm a 40 some I think I'm 48 walking on the planet. I've had lots of hits that I have to recover from. So I used to get strep infections a lot, and then I got sick in Mexico with the GI thing, and then I got
You had Lyme.
I had Lyme disease. You know, blah, 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 blah. So you're like a series of multiple hits. So when I was the sickest in my life, it was after I had my third baby, and I couldn't wake up. I mean, I was so anxious. I remember being at work. I worked at Pediatric Alternatives in Mill Valley, and like I just was like on the floor, like begging for mercy, kind of in between patients, pumping, and I was like, okay, I'm at a rock bottom moment. And what had happened was that's when I got diagnosed with Lyme disease. And so I don't know, had I just been bit by a tick, or was it an old tick bite that I had when I was in Connecticut at my family farm? Probably that. But the long-standing fatigue, having the third kid, working, it just was a series of multiple hits. And then it made it so what I was eating was like totally not working for me. I typically have a really strong stomach, but like, there was like, I just was having bloating and digestion issues, and I couldn't figure it out. And I'm breastfeeding. So I was trying to eat all that like high fat, really a lot of high fat food. I wasn't, it's like, I would eat food. It didn't feel like it was medicine. It felt like it was like working against me. And then I just had this long-standing depression, or it was anxiety kind of depression. And you just go through life often, especially when we're busy, and you just assume that it's normal, right? And I loved what you said, that the colors are dull. Like I just was like, obviously this is because I have 3 kids. Like obviously this is because I'm like just working and I'm a new mom, and this is the breastfeeding, or all the different justifications that we make, instead of saying, oh no, I'm actually like pretty diseased. I'm not in good flow. And it takes and then like I got in front of a doctor who was just like, dude, you're like, you have so many holes in your bucket that your whole life force is flowing out. And your manifestation is anxiety, depression, insomnia, fatigue. I had real muscle fatigue. Like I would wake up in the morning and it felt like I had run a marathon, and I really hadn't run anywhere. And I was like, why am I so tired? Why is my body so tired? Like
I remember when you used to run though, and your knees would really hurt.
I had really bad
joint pain.
I had really bad joint pain. And it's so interesting. I don't have any of that now. Now I don't run as much as I used to, because I realized for me, running's not my jam. Right. So, or if I run, it's a 20-minute run, not that back then I was running 6 miles, 8 miles. I was really flogging myself then. Right. And now I'm just approaching my body so much more with so much more love. Like it's the wisdom of growth, and then the filling up of the bucket. So my hormones are more in balance now. I know we've done all of our genetic tests, right? I know what I need genetically, like from what gene issues I have, like, and really that makes a huge difference. And I know so much more about food and what I need. And it's interesting, like if I feel inflamed, or if I feel like my bucket's starting to get a lot of holes, like I turn to meat and vegetables, period. And it's just like meat, lamb, and like very few vegetables. And that's the way I heal my gut. Very different than the way you heal your gut if your bucket is right.
It's really interesting. Just knowing how, like, what's soothing as far as foods go for you is really, really, really important, because like what's going to build you up is really different for you and I. And I had just interviewed and which I haven't even talked to you about, a woman who is a postpartum doula, and she really looks at it through Ayurvedic medicine, and what she was advocating women eat, which, she was awesome. I loved her. But if I had eaten what she was suggesting eating after giving birth, I would have really been depleted really fast. So it was quite interesting to hear it, because it was very just like carb rich and not a lot of heavy fats and proteins. Kind of like, it was quite interesting, right? It was very like sugar rich. It was a different way. Very moistening, as far as there was a lot of water there and stuff, but which is really important. But it was quite interesting. And I was listening thinking, this is why we do individual approaches to medicine, right? And why, because I just really do recognize, you and I can read every book on diet, and which we've done a lot of this, go to every conference. We've done the Andrew Weil conferences. We've done all this stuff and heard different people speak about food. And it's quite interesting, because it really comes down to the individual person. It is not, there's one set of rules. There's no diet trend. I can't follow a diet. There's no like 30-day program for this that really is going to be appropriate for me. It's sort of this strategy of individualism that we need to do with our diets, and really think about us, our lifestyles, what's around us, what I can get. I have to get a lot of frozen fruits and vegetables where you get more fresh, because you just have more access where you live. So it's just things like that, and knowing how to choose it, and knowing how to fuel myself. And me, I have to eat every few hours, and I need to know how to eat every few hours. For me, it's more like a protein and fat kind of thing I should be eating. But if I was left to my own devices and like what I like to eat, honestly, I would literally, when I was a kid, I would just eat berries. Like, I was big, like, eat berries. Like, I remember really clearly that being at restaurants and being like, this food looks disgusting, I just want berries. And they would give it to me as a kid all the time.
Oh my God, that's so funny.
And that would be like a meal like that.
I want a burger.
And that did not work for me. I would get very hypoglycemic, and, it didn't work at all. And then I ate so much soy, and then I found out I react to soy, and getting rid of that, remember, all my headaches went away. It was like,
well, we both just got so sick when we were soy eating vegans. That is the one commonality that Kara and I both had. Both got incredible, and we were in bad shape. And we were in really bad shape when we showed up to med school, both of us. And I had been a vegan for, I think by the time I got to naturopathic medical school, I'd been a vegan for 3 years, almost 4. And before that, anorexic. So I was a recovering anorexic vegan. And
not a great combo. No.
And you become a vegan when you're a recovering anorexic, because, it totally perpetuates the eating disorder in a sense. And I'm not saying all vegans are eating disordered in any way, shape, or form. I'm not saying that. But if you do have an eating disorder following a very strict diet after you're kind of forced out of your eating disorder from interventions from loved ones, it creates rules. So I was extraordinarily nutrient depleted. That was the sickest time I was in my life. I had so much vital force because I was so young still.
You were young. In your 20s, you can get away with this stuff.
But my hair was so dry, and we went to med school, and we both started studying Chinese medicine our second year, right? And when you sit in, the second we both sat in with the Chinese professors, they were like, okay, you guys, like, you're all blood deficient. You're all nutrient deficient. You're just like, what's wrong with you? Looking at from Kara to me, and I guess we looked a little more anemic than we should have. However it looked to them, it was like 2 seconds to diagnose. But the path to healing for Kara was very different than the path to healing for me.
I'm laughing because I'm just remembering us coming in like always late, because we were doing 2 programs at once, and the Chinese professors were pretty good at like starting on time and being really, but the Chinese medicine stuff was a little bit easy. It was like they would write it out, we would memorize it and regurgitate it back. There wasn't a lot of things to remember. It wasn't a lot of thinking. So we would just like come in late with like a coffee and like a muffin or something, like, oh, we stopped for our food. We couldn't possibly be on time. So bad. We were so bad that way. And we would come in and And yeah, exactly. They would be like, these people, they use their brain so much because we were trying to get all this stuff done. And I see that a lot these days and a lot with our patients and clients that we work with. It's a really big deal because using your brain a lot, if you have like a high functioning job where you need to like be decision making and be fast and just kind of like really process information, and it's not just sort of like a more peaceful like artist job as opposed to what I'm talking about. But if you're in a job that uses a lot of energy in your brain, you deplete your nutrition so much more than the next person. So
Your B
I see
vitamins.
that. Yeah, you really, it causes a blood deficiency in Chinese medicine, but it's like focus and brain work really do draw energy from us. It's just not like in the Western sense. We don't recognize that, but it's a really big deal, and food affects that so much. And that's why I have to eat every few hours, because otherwise you see it. I'll be working with Hillary. Sometimes we work very long hours together, and she'll say, "Oh, give Kara a break. She needs to eat something. She's not even. I can tell her brain's not working. Go take a break." And you're always right.
That's like so offended, obviously, because I don't say it in the nicest way, probably. But you can literally see her go,
yeah.
And I'm talking fast, and it's like you can just see the processing stops. And she gets a little like hazed, you know, where you're like looking at the photo and you're trying to see the backward image. Like she's like, your vision's a little bit not quite right. I was like, blood sugar dropping, red alert, red alert.
Yeah, and so
because I could probably power for another hour and a half.
You always can power for many more hours than me.
I mean, so it's just constitution, right? And then what happens is Kara craves liquid, water, electrolytes, and
I'm doing right now,
and vegetables, and I crave a burger. Like I want like meat, like I want like a pound of burger or something, you know, not and vegetables, yes, but like if I eat like red meat, then I'm fine for the rest of the day. I mean, it's just this thing is very individualized. So can I go back to this bucket? I just finished a fascinating, and I haven't unpacked it all with you yet, but the long COVID training. One of our beloved naturopathic doctors, his name is Paul Anderson. He's above and beyond. He teaches at schools. He's just a real smart, on the forefront of medicine and integrative medicine. And he taught us about long COVID this weekend and what COVID itself has done to many of our systems. Okay. So like most of us by now have been exposed to COVID, and many of us you get through it. Mm-hmm. And many of us, some of us struggled, and it took way longer than we had expected to recover. And the thing about COVID that was really hard and still is hard is it's very hard to predict who's going to not do well with it. Mm-hmm. I mean, sometimes it's clear, like you need more mitochondrial support, but like some people that I expected would have a faster, more robust recovery took 6 weeks to recover, or 8 weeks. And the long COVID situation is really getting into anxiety, depression, insomnia. So it might not, and sometimes fatigue. So looks like chronic fatigue. And one of the things that's happening in all of those patients, and for you might not feel like, oh my God, I have long COVID, but I've never quite been the same since I got sick. And then all of a sudden I'm like very inflamed, or I'm flared, or I'm depressed, or I'm just like, or my sleep's off. And it might be like, oh, wait, I might have a little bit of long COVID, or it might have just been the straw that broke the camel's back. So that just that final hole in the bucket just made the system go bleh. And where we're seeing the issues the most are in the digestive tract and in the blood-brain barrier. So these are two places where we're supposed to have extraordinarily strong protection from the inside to the outside world. So the crazy thing is that the gut tube that starts in the mouth and ends in your cute little butthole, it's a winding, massive track. Yes. And it's all considered the outside world. It's a trip. But when you eat something, it's going through a tube. Your body's job is to extract what it needs and to let the rest of it go. And that whole process is supposed to stay the outside world. It's a tube like this. The inside of the tube is the outside world. This is your body. That's your inside world, right? And what happens when you get a little bit sick is things get leaky. And it's so fun now in 2023 because we've learned about this in medicine from the beginning, and it was like that people thought we were quacks, and now it's really proven that
It is proven.
that proven in
Absolutely.
papers that these tight junctions get loose. The outside world and the inside world are no longer very separate. Our immune system starts to come in and get very activated because it's the outside world is slipping into the inside world, and the immune system is going, red alert, this does not look like how it should. The immune system is not always the smartest system. It can create a lot of inflammation when it doesn't need. And all of a sudden we have what's considered leaky gut or food stuff. So post-COVID, many people are experiencing gas, bloating, food sensitivities that they never had before. Or it didn't have to be even COVID, but past a mold exposure or past a virus or past. And so what that is just there's so many holes in your bucket that all of a sudden the gut's just like done.
Yeah. Let me make sure that's clear, because I think that's so key, because it's just hard to think about, because you think, well, our digestive tract does what it's supposed to do, but you're supposed to pull in all your nutrients, right? And these are proteins, but also your immune system's there, most of your immune system along your GI lining. And then when that barrier function is compromised, more of those proteins from the outside get in, and then the immune system starts to react and chronic inflammation happens. And then it turns into systemic inflammation. So it can be anything. And I remember you said, this was long ago, right when COVID came out, you said, oh, what's really interesting is the data showing that vitamin C is being absorbed much higher. Usually vitamin C is very poorly absorbed in the GI tract. Actually, you can only absorb like maybe 400 milligrams or so, but we take these high doses, and then that's how you get diarrhea, right? So you were saying, oh no, they just keep taking it and they can actually pull it in because the immune system is activated from the COVID, and the gut has some kind of inflammatory response. It's pulling in more vitamin C. It's sort of an interesting thing to think about. Like, of course, your immune system is going to be affected by viral infection.
Well, and what it's leaving behind is that people are just messier. Okay. So, and what's happening in the gut, I just freaked one of my friends out, who's also one of my patients. And, I was like, yeah, your blood-brain barrier is being impacted. And she's like, wait, what are you saying to me? And I'm like,
that sounds really scary. Blood-brain barrier does sound really scary, but it literally is the same thing. It's leaky gut of the brain. It's literally the same thing.
Leaky brain. And leaky brain contributes to brain fog, memory issues, anxiety, depression, or dysthymia, somewhere on that. And we have seen it over and over and over. One of my closest friends, Sarah Binney, who's a pediatrician, just like, oh my God, these teenagers with the recovering from COVID, with the brain fog and the fatigue and anxiety and insomnia and depression. And so, we're all seeing it happen, but we're not necessarily addressing it like, oh, okay, this is a post-viral infection. So I don't want to go off about the long COVID, that's its own show. But I just want to tell you, we've all been exposed to this newer novel virus that has multiple implications. And if you're kind of like, and we had this chronic, hardcore, gnarly stress imposed on us in 2020, and for many years, the way our society changed, the way that you've all of a sudden felt like if you breathed on the wrong person or sneezed on the wrong person, you might kill their grandmother, or like just thoughts in our brain where it was like, wait, what? Like I could breathe and potentially harm somebody, or so we were just and the straight up social isolation. So the long and the short of it is, many of us are walking around with compromised gut tubes, compromised digestive tracts, and compromised neurological function. And isn't it interesting that you can't get a patient in? I cannot get a patient in to see a neurologist for months because of headaches, dizziness, all the like neurological issues that have come up post-COVID. And so if you are having some of those symptoms, just not feeling the same sense, or brain fog, or slightly weird GI stuff, bloating, gas, then like we need to work on your diet. And what Kara was saying is that individualization of your gut and the way that you were inflamed is really important. And so we're really advocating at this point food sensitivity testing for people. It's not perfect medicine in any way, shape, or form, but it is a really good screening test for us to get to see what is the degree of barrier dysfunction. Are people creating inflammation and an antibody response against all the foods that they're eating, or just specific foods? And how can we help heal the individual organism faster with their gut health and their brain health through GI testing or food sensitivity testing is one way that we're feeling like is really important now.
It is. And I think that it's always really interesting to hear back from people about what I had Pauline on while you were gone, and we were talking a little bit about this. What people come back and tell you after they take out, and it's usually not all the foods that come up. We can kind of pick out, okay, it's probably this thing that's the real problem. And so it's not ever usually more than like 2-3 foods you have to eliminate, really. It's really not. So I always like to say that, like, don't take the test at face value in any way whatsoever. But anyway, then people come back and it can be completely life-changing. And it's what you said earlier about how you didn't know that you weren't doing well, because we're like put here to survive. Like, people will just figure it out and push through all kinds of sicknesses and show up even when they're really deathly ill. Do you know what I mean? People just do this. It's a survival skill when people do it. And so when you do something like take out those foods that are causing chronic inflammation, life is completely different. It's like, I had stomach pain every day. I didn't know that was not quite right. But what we hear most actually is the depression, the anxiety symptoms of, I didn't know. I was so stressed all the time. I didn't know. And I had no idea that taking out that food would actually help that. Like, I wasn't even complaining about that. I thought that was just the way it is, you know? So that's the most profound thing I think that it's like the quality of people's lives really change. It's incredible to watch and hear back over and over and over again.
It's just one of the easiest things that we can shift. And it's the most important. Like, if we're impacting or impeding the way that we absorb nutrients and the way that we digest, if there's inflammation in our GI tract, like it impacts everything.
It does.
And these tissues can heal. So it's not that you have to avoid things forever in any way, but the food is medicine. And if you're eating foods that are no longer acting as medicines, but they're pro-inflammatory, then you need to just remove those triggers, help really your gut lining heal again, get the integrity back, calm down the immune system so that you can just go back onto normal living. Like, we get to heal ourselves over and over and over. It's a process that we're going to do over and over and over again. But when we have smoldering inflammation, like I said, I feel better at 48 than I felt when I was 28 by a mile.
Right.
So we get to really heal ourselves.
Yeah.
So, and that's the exciting part. It's not. So anyway, we're just saying, like, the connectivity of these things is sort of mind-blowing, and stepping it back to ensuring that what you're eating is medicine is kind of the foundation of our health, right?
Yeah. And we did that whole talk without even mentioning sugar.
Okay. But now I have to jump to see a patient, and I bet you do too.
I do.
I love you.
Love you.
Thanks for being here.